This one doesn't know her dad yet. He's not around much, right?
Yeah. She's so upset.
Yeah. No, I don't think she wants that. I'm sure they have like.
Oh, they're ready for it.
Oh, you can draw like the anatomy on the board.
Hold on a second.
Paramedical.
Okay, go ahead, ma'am. Hi, hello?
Yes.
My husband has a really bad pain in his chest.
Okay, what's the address that you're at?
Oh God, why can't I sing? 52 East Cortez Drive.
Okay, how old is your husband?
50.
50?
Yeah.
Is he conscious and breathing right now?
Yeah, but he's all over the bed.
Engine 14, Channel 2 EMS, chest pain, 52 East Cortez.
Hello?
Yeah, I'm here.
Okay.
We are en route. Okay. The best thing to do is just get him in the most comfortable position for him and keep an eye on him to make sure he keeps on breathing, okay?
Okay.
Relax. You're in great hands, sir. Okay, don't be worried. Just relax.
So we're going to give you some medicine to help your chest pain, okay? Is the pain getting worse right now?
Okay.
Try and relax as much as you can, sir, okay?
Breathe in through your nose and out through your mouth. Just relax.
It's Dr. Isaac. I was paged. Do we know how far out he is?
This is Frank. He's a 50-year-old male. He had a sudden onset of chest pain. He rated it about a 6 on a 10 scale.
You feel short of breath at all?
Yeah, I'm nauseous.
Okay. Did the pain go up into your shoulders or your neck at all?
Right across
Across your chest. It's Dr. Isaac here.
I've got pain scan.
Okay, give him nitro. What we're going to do is we're going to give you a few medications here.
How are you doing?
This is very conservative. He's got a prox 80 that wraps around. You can take it. Yeah. I'm going to go out and talk to your wife. Do we know if his wife is here?
Thank you.
I believe he's having a heart attack involving the front part of the heart muscle. My hope is that we can angioplasty or go in with a balloon and open up the blockage. Under that circumstance, we may use just a balloon, or we may have to use a stent.
So you're not going to do a bypass?
Well, he may be looking at a bypass, and he may be looking at a bypass tonight, okay?
A silent killer snuck up on Frank Clemensburg tonight. A killer that takes over 1 million lives each year in the U.S. alone. His condition has been stabilized, but Frank is not out of the woods yet. A blocked artery now cuts the flow of blood to his heart, starving the muscle of the oxygen required to keep that heart alive. And if not opened immediately, Frank could become yet another victim of America's #1 killer. I'm Cliff Robertson. We'll return to Frank's struggle later. He, like many others, did not know of the perilous dangers of cardiovascular disease. 70 million Americans live with heart disease every day. And this is the even more alarming part. Millions more are unaware that it lurks within them in its early stages. For the next hour, we will explore the causes, the latest treatments, and most importantly, how you can prevent this deadly disease. Please join us for a matter of the heart.
We did the first successful operation for an aneurysmal thoracic aorta here. I just observed there must be a better way to do this.
And then when the heart surgery came along,
we were cast in a different role again.
But it was far from a screwy idea, and he truly was a man of vision.
There it is, America's #1 killer right there before your eyes.
The cardiovascular system, a brilliant network propelled by the human heart. Our ability to observe, feel, listen, understand, breathe, our very existence is driven by this complex design of circuitry. And only the slightest malfunction to this tapestry can oftentimes result in grievous consequences. Stroke, heart attack, loss of limb, even death. To understand how one becomes a victim of this silent killer, we must understand the dynamics of this wondrous system. Within each of us lies this wondrous pump. Slightly larger than a clenched fist, its efficiency and power are matchless. With each beat, blood is propelled through the arterial system, an amazing network of vessels that nourish every organ and cell of the body. One of the first areas to be supplied with oxygenated blood is the heart itself. Small vessels branch out over the surface of the pump into a series of tributaries called coronary arteries, which feed the tissue of the heart muscle. But through a deadly process known as atherosclerosis, these vessels can become narrowed, preventing the purified blood from reaching its destination. Slowly, the area beyond the blockage begins to die until the body delivers the final painful wake-up call. The heart attack.
Frank, try to concentrate on
Frank, relax.
Tonight, Frank Clemensberg is experiencing the agonizing results of this potentially fatal attack firsthand.
You're doing a good job. Hang in there, buddy.
And although he may not know it now as he endures the pain, Frank is a very fortunate individual. Many heart attack victims never survive this deadly event.
I know you're feeling that. You just need to try to concentrate on your breathing.
His life hangs in the balance as cardiologist David Reisig investigates a network searching for a problem area.
See, look at that. You see what I said? I thought it wrapped around. You see what it's doing?
In order to plan a treatment strategy, Reisig must first identify the culprit of Frank's life-threatening ailment.
Found the blockage, okay?
Was it blocked?
It's blocked. It's severe. Could someone send word out to his very nice wife that we still have a little bit of work to go?
I'll get out there.
Okay.
The mysteries of the human heart. Prior to the 20th century, little was known about the cardiovascular system or how it operated. Treatments were, in essence, non-existent. That was until medical innovators took the very first bold steps into the mysteries of the human heart. Perhaps the most significant hurdles in the evolution of surgery were resolved over a century ago. The developments of antiseptic methods which reduced infection and anesthesia to control pain launched a new wave of medical treatments. And while many surgical procedures thrived after these discoveries, operating on the heart and blood vessels was still forbidden territory. Although some cases of treating cardiovascular ailments were reported as early as the turn of the century, most were limited to emergency, last-ditch efforts with little success. With no effective method for charting out treatment plans, all ventures into the blood system were merely exploratory. That was until 1929, when a young intern working in a small Berlin hospital would risk his life to advance the crusade. Werner Forssmann theorized that small tubes could be threaded into arteries to discover ailments. Working in secret on experiments banned by his superiors, Forssmann used the new invention X-ray to successfully guide a catheter into his own heart's artery. For his brave act, Forssmann received an unexpected accolade.
Well, he was criticized, of course. In fact, he was He was criticized so much by his chief that he threw him out of the clinic, fired him. And it shows how little, understanding and appreciation of the true advance that he had made.
An advance that would ultimately lead to Forsman receiving the Nobel Prize and would begin a new era in vascular surgery. One of the first surgeons to put this new window into the arterial system to work was the Texas tornado Houston's Michael DeBakey.
Well, I think one of the major developments in that regard was the development of the surgical treatment for aneurysms of the aorta, particularly thoracic aorta. And we did the first successful operation for an aneurysm of the thoracic aorta here, replacement with a graft.
In the 1950s, DeBakey began replacing ballooned aortic arteries with synthetic conduits assembled on his wife's sewing machine. Suddenly, vascular surgery was making major treatment inroads. But mending the gem of all organs, the beating human heart, continued to be inaccessible. 1,000 miles to the north at the University of Minnesota, a young resident was witnessing the development of a new machine that would allow surgeons to take that last monumental step into the heart.
There are only two places in the world doing open heart surgery. The Mayo Clinic and the University of Minnesota, they're only 90 miles apart. So obviously it was tremendously exciting. Patients coming from every country around, as well as all over the United States. And at that time, the bubble oxygenator, which is today so commonly used, was just beginning to make its appearance.
After almost 20 years of experimentation, Dr. John Gibbon constructed a heart-lung machine that kept blood circulating through the body, bypassing the heart while it was stopped for repairs.
And everybody was working hard night and day. Of course, in Minnesota, the best thing to do probably was to be in the hospital or in the laboratories working. And so a lot of so-called discoveries were being made. There used to be this joke we used to tell was that in order to get on the operating schedule at the University of Minnesota, you had to invent an operation. And of course, that's just what was going on.
The pulmonary bypass machine put heart surgery at the forefront of medicine. And by 1960, DeBakey had used this discovery to build the world's premier heart center at the Baylor College of Medicine. For those under his tutelage, like Associate Dr. Denton Cooley, the potential to mend previously untreatable heart ailments appeared boundless.
And I've always thought it was sort of like having a door that was locked so that you could not get into an outside area or a new world. And those of us who were fortunate enough to be given the key to that door were actually in a role as explorers, adventurers. Almost every case that we operated on was a reportable case. It was new, it was different, and it was exciting and interesting to everyone.
Many abnormalities of the heart could now be successfully and safely mended, where previously patients were restricted to a life of bed rest. Defective valves could be replaced with mechanical devices. Miniaturized electrical pacemakers could be implanted to control irregular heartbeats. And heart surgeons became media superstars.
It seems to me previous surgeons were identified with neurosurgery. The brain surgeons are considered to be the real leaders in those days. But then when heart surgery came along, we were cast in a different role again as almost a genius quality.